Anterior wrist palpation. So we have already discussed the posterior wrist palpation. Next is the anterior wrist palpation. Again, start with the starting position. So what should be the starting position? The patient should be seated on a stool or chair, and the forearm and hand should be rest over the top of the table or over a couch. So we can start the palpation from radial to ulnar or ulnar to radial. So let's start with radial to ulnar palpation. Here you can see I have already marked several structures which is found around the wrist. This is basically this red line is representing the location of your radial artery. Next, here it is the overlapping of two tendons. The first tendon which is found from the radial to ulnar, when we start the palpation from radial to ulnar side, this tendon will be your flexor carpi radialis. And at, you can say almost on the same location, but it is little bit proximal. The another tendon is found that is called your flexor pollicis longus. So these two tendon is found almost at the same location. The next tendon, when we proceed towards the ulnar side, that will be your next tendon, which is located centrally, that is your palmaris longus tendon. Again, just adjacent to the palmaris longus, another tendon is found, which is your flexor superficialis. And when we reach over the ulnar side, the last tendon which we can identify is your flexor carpi ulnaris tendon, and just adjacent to the flexor carpi ulnaris, another artery is found, that is your ulnar artery. So again it is represented here by this red line. These two black mark is also there. Basically this is the location of your tubercle of scaphoid, and this is the location of your pisiform. So let's start with palpation of all these structures separately. So first you have to place your palpating hand over the more lateral side or more radial. So just place it like this, slide it toward the ulnar side, ask the subject to make a face like this, and then flex the wrist. At the same time, you have to just try to identify the elastic consistency, and I can palpate it just over the radial plateau. This is the location of the first tendon, and this is your flexor carpi radialis tendon. Relax. Again, when you proceed little bit more proximally and ask the subject to perform almost same motion. One more thing, if suppose you are not able to identify this tendon, if your subject is bulky and basically this subject almost all tendon is very prominent, but if your subject is very bulky and you are not able to identify only with the wrist flexion movement, the tendon is not getting prominent, then ask the patient first flex and then radially deviate. Yes. And apply the resistance. Means you have to produce the isometric contraction of flexor carpi radialis. So this tendon become protruded and is very easy to identify. Now from this location, basically this is found just anterior to the tip, your radial stellate process or radial plateau. From here, you have to shift your finger pad little bit more proximal, and again differentiate between two different tendons, that will be your tendon of flexor carpi radialis and flexor pollicis longus. Again instruct the patient for producing the same movement, means wrist flexion, and differentiate between these two tendons. So I can feel almost the location is same, but I can feel two different tendons over here. So this is the location of your flexor carpi radialis and flexor carpi ulnaris. For flexor pollicis longus. Basically for flexor pollicis longus, you have to shift your palpating finger more proximally because this is the one tendon which passes through the your carpal tunnel. So it is prominent little bit more proximally to the wrist line. If you try to identify near to the wrist, you will not be able to identify it. That's why you have to palpate it about 1 inch or 1.5 inch more proximally to the wrist line. Now come to the next structure, that is your radial artery. So just adjacent to your tendon, first locate your tendon of flexor carpi radialis, and just adjacent may shift your palpating finger little bit more radially and apply gentle pressure. Yes, even you don't have to apply any pressure, just position your palpating finger just adjacent to the tendon of flexor carpi radialis more radially and try to identify the knocking of the vessel. So here I can feel the knocking of radial artery. So and in most of the clinical condition, basically we measure the pulse through the radial artery. Now come to the next structure, that is your tendon of palmaris or longus tendon. So it is very easy to identify. It is very prominent tendon in most of the subject. You can identify, even there is no need of palpation. You can identify with observation. So even if you are not able to identify in the subject, just instruct the subject to opposing the little and thumb, little finger and thumb like this, and apply again the resistance. You can see two tendon is getting prominent. The first tendon from the radial to ulnar side, it will be your location of palmaris longus. And again, shift your palpating finger more ulnarly and instruct the patient for the same, means make a piece. But in this condition, for the confirmation basically, you can identify both tendons simultaneously. But if you want to specify or identify it exactly, then ask the subject to make a pace and place your finger in between the fourth and fifth finger, which basically produce the isometric contraction in your flexor digitorum superficial. So just position your finger like this basically, and just place the finger in the palm and asking the subject to apply or try to make a tight twist. So this tendon is getting problem. So this is the location of your tendon of flexor digitorum superficial. The next tendon that we can identify here is your location of flexor carpi ulnar. So again try your shift your palpating finger more ulnarly and then ask the subject for same make a fist and ulnar deviation, and at the same time just perform the transverse palpatory technique and you can identify the protruding tendon more ulnarly. So this is already marked and this is the location of your tendon of flexor carpi ulnaris. If you follow this tendon more distally toward the base of the wrist, ultimately you will reach over the pisiform bone, and it is a bony projection, a clear cut bony projection. Just perform the flexion and extension of the wrist and you can identify a small rounded bony projection over here. So this is the location of your pisiform. Means after identification, vice versa, we can identify first the flexor carpi ulnaris tendon and then follow it distally, and ultimately you will reach over the pisiform bone. Or you just identify the pisiform bone and move proximally and try to identify the tendon that will be your flexor carpi ulnaris. So now come to the next structure, that is the location of your ulnar artery, especially neurovascular structure can be identified over here. So this is the location of your ulnar artery and ulnar nerve also. To this tendon, these two structures is found over here. Now shift your palpating finger more ulnarly and again place and apply gentle pressure or only locate your palpating finger pad just adjacent to this tendon and try to shift it and try to identify the knocking of the ulnar artery. So I can feel it over there. So this is the location of your ulnar artery. One more thing, by following your tendon of flexor carpi radialis, I missed this. So you just move your thumb pad, first identify the flexor carpi radialis tendon. Method is same. Just ask the subject to make a fist, flex it and radially deviate. Palpate it and follow it distally. Relax and extend the wrist and ultimately you will reach over a small, if you compare this bony projection, it is little bit small as compared to the pisiform mode. So small bony projection at the radial side at the base of the wrist. So this is the location of your tubercle of scaphoid. So almost it is done.